Hi, and welcome to Fairview Range Focus. I'm David Hall, Chief Administrative Officer for Fairview Range, and it's a pleasure to welcome everyone today. We're going to talk about quality in healthcare today, and I'm surrounded by some experts that I'm going to introduce, and we're going to talk a little bit about quality in healthcare and what that means, what that looks like, and what does that mean to you, the public. Welcome to Heidi Lahti, who is the Director of Clinical Support, Angela Olson, RN, who is Process and Informatics Supervisor.
That's correct.
Did I say that right?
That's correct.
Excellent. And Katie, Blight, and Stacy, Wesley, and your quality RNs.
Yes.
Is that right?
Yeah. Yes.
So I could make a joke about that, but I won't. So thank you for joining me today. It's going to be fun to talk about quality, and we hear that a lot in organizations, especially in healthcare. So let's start. Let's talk about what exactly is quality in healthcare. What's that mean? What's that look like?
Sure.
Angie, can you help us?
So quality in healthcare is really doing the right thing at the right time for the right people in the population that we serve to achieve the right outcomes, and that's ultimately what we're looking for. We've got a team of great nursing staff here that have varying clinical experiences, and our goal is really to provide that, to support our providers and achieve those outcomes utilizing best practice within the organization. Our goal is always to support the vision, missions, and mission statement of the organization and our strategic plan.
Okay. So what are some of the activities that occur that you're doing to actually measure the quality or to gauge that?
Sure. So we are always looking at concurrent monitoring of a lot of our quality indicators. So some of the things that we're measuring is, say, for example, if a patient has a heart attack or what's called an acute myocardial infarction, we're measuring some of those process indicators. We also measure timeliness of the care that we deliver and the way in which we deliver it. We assure that we are always meeting the best practices. Those are just a few of the things that we measure. Patient experience is one of our primary indicators that we're always measuring as well.
Okay. So then we talk about why does it matter? I mean, all these things, it sounds impressive, it sounds important, but why does it really matter? Stacy, can you help us understand why does it matter to the communities that we serve, our patients?
By improving efficiency and safety, decreasing costs, reducing readmissions and mortality, with a strong focus on patient experience, our goal is to improve the overall health of our community and educate for longer, healthier lives.
Okay. So is there specific things that you do that you set out as goals to in order to accomplish that?
I'm going to answer that first.
Okay.
Great. So Stacy and I, we monitor best practices and help educate the physicians and the nurses on the whys that we're doing things, so they have a better understanding and can kind of take some ownership over those things as well. So some of the initiatives that we're currently doing, we're introducing the healthcare home care coordination model into our clinic settings. We're helping facilitate screenings for breast cancer. We've been focusing on influenza because this time of the year is when we start doing flu shots, and we just want to have everyone remember to get their flu shot, and we have flu shot clinic dates and times on our website, or they can call the clinic. And then also we've been working on the Seeing Sepsis initiative by early recognition of the symptoms and standardization of the treatment.
Okay. So you said a big word there.
Sepsis.
Sepsis.
Yeah.
So help us understand what exactly that is.
So sepsis is the body's overwhelming response to an infection. It can lead to tissue damage, organ failure, and or death. So some of the things that we're doing at Fairview Range is we've formed a team of physicians and nurses to kind of help look at what we're currently doing and try and improve those response times, because early recognition is really the key to help our patients have better outcomes.
Okay. Sounds important.
It is.
Yeah. So a lot of the work that you're doing, it sounds like it impacts the actual care that's being given by physicians.
Absolutely.
So do you interface or interact with physicians directly as well?
On a daily basis. So our team really is working with them on a daily basis. They're looking at the charts to making sure that they have documented appropriately, that they've infuse the best practices, as well as meeting with them to educate them on upcoming measures and how we can achieve those. Also looking at how we can support them utilizing our EHR, our electronic tool that we call Epic. So making sure that that is in their practice as well.
Okay. I've been working in healthcare for a couple years, and I know there's been a lot of change over the years in regards to where quality was always important, but it's given a different emphasis today than it was many years ago, when so much of our reimbursement was based on volume. The more people that we saw, the more we were reimbursed. And as I understand, that's kind of changed too as it relates to quality.
Yeah, absolutely. So now more than any time, you know, our quality indicators are visible, and that's exactly what we want them to be. Is we want them to be visible, and we need to be accountable for those measures. Our outcomes are important. It affects the number of lives in which we serve, and so it's very important that our scores are not only good, but the outcomes and how those patients, their end results, that they are good as well. Those numbers are visible not only to our community, but to our accrediting partners and our payer sources. And so we get measured on those, and we have to be able to speak to those and assure that those numbers are going in the right direction. So we're constantly trending that data. We're pulling that information out, whether, you know, it's many different ways in which we can measure that, but we're always looking at that data.
Okay. So how exactly is quality measured? I mean, you've mentioned several things in regards to measurements and data being submitted, but can it get down to brass tacks here? How does that actually measure?
So we have really two kinds of ways that we can measure it. We can measure it through process to look at our efficiencies and the time in which we provide that care, and we also look at our outcomes. So whether or not it's their mortality rates or their infection rates or their complication rates, we look at all of those indicators to assure that we're capturing the best outcomes, and we're changing our practice so that we're constantly changing, we're constantly improving, and getting those outcomes that we so desire.
Okay. A minute ago, you said something about benchmarks, and heard that term. How does that relate to healthcare and quality in particular? What exactly does that mean?
So there's benchmarks, and that is the essentially the quality standard that we see, and we see those kind of created at a local level, we see them created at a state level and a national level. So we are constantly looking at that information. It's always trending, it's always changing, and we want to be assured that we are ahead of that benchmark. That's our ideal goal, and ultimately that's a moving target, and we're constantly changing our process to achieve that.
Okay. And does that correlate to actually affecting of how the changing of how care is given as well?
Absolutely, absolutely. So anytime that we see that we're not meeting a benchmark, we really have to look at what the root cause is of how we can best improve the care that we're delivering. And so we drill down to where we can best impact the care delivered and make those changes.
Okay, good, thank you. Quality is an important thing, and it seems like it's just continued to grow as well, and certainly it's becoming more of a factor, I think, for all of healthcare, not just hospitals.
Absolutely.
And I know long-term care is also moving that path as well, where quality is being measured and looked at much more closely than ever before. So good. Now, how about, let's talk a little bit about patient experience.
Sure.
And Heidi, I know you're one of the leaders in that initiative. Can you talk to us a little bit about that?
Sure. Patient experience is measured through patient surveys. We collect information from patients through two types of surveying. One is an immediate survey completed on a tablet at the time of care in the hospital. And the other one is through surveys that are mailed to patients a few weeks after their visit. And we take those surveys. They are anonymous and confidential unless a patient chooses to provide their name for additional follow-up. We review that information as we receive it in a report format, and along with the comments, and we review those at the Patient Experience Committee.
Okay.
Our Patient Experience Committee is made up of community members and employees. And we meet monthly and really take a close look at all of that data we receive from our patients.
So what's the goal? I mean, you review the data, And what is the goal, or how do you use that data then?
So we take that data and we look for any trends or common themes, and if we see that in certain areas or departments, we work with that department to put together an improvement plan. Some of the things that the committee has worked on are charging stations for the waiting room, for emergency room, and urgent care setting. So when patients come in, they always have their cell phone. They don't know how long they're going to be there. We give them an opportunity to plug it in so they can stay connected with their families. Some of the other things that we've worked on is helping in the inpatient setting create communication boards that are beneficial to both the patient and the providers as they care for the patients while they're there.
So how can the community impact patient experience? I mean, do they have an opportunity to really influence that directly?
Absolutely. Always sharing with your provider and healthcare team your experience in healthcare, good or bad. Share that with your provider. Completing the surveys, very important. That's invaluable information that we receive, that we take a look at, we use, and we truly appreciate the feedback that comes from those surveys. And also through participation on our Patient Experience Committee. We're always looking for community members and appreciate new members on the team as well.
Okay. Well, I know if I can speak from personal experience, I mean, I've seen that where some of the information that you're getting back has really resulted in changes in our organization to really improve patient experience, and so that's a great thing. It's good to see, and like you said, the feedback from the community is essential for us to be able to do that so we know what they want and how we can better meet their needs. So, good. All right, thank you. And Stacy, I'm going to pick on you again.
Yes.
Hi. I moved again. As a patient, what's their role when it comes to quality care? Or do they have a role?
Yeah, that's a very good question. Yes, patients and their family members have a key role to play to ensure that they do receive good quality care. You can do this by being active in your care, by working closely with your healthcare team, and making decisions about your healthcare team or healthcare. By asking questions. Ask your physician or healthcare provider what the scientific evidence has to say about your health condition. By scheduling your annual physicals and preventable exams. And also by signing up for MyChart. MyChart is there to improve communication between yourself and your physician, and it is also there for you to access your most recent medical information.
Okay. So I heard a couple things there. Can somebody speak to MyChart? I've heard some people talk about MyChart and what exactly that is. Can someone explain that a little bit further?
Sure. It's our ability to access essentially our own medical records and see information. It's for the most part concurrent, so you're able to see your lab results, some x-ray reports, notes to providers. It's an avenue, really, a conduit avenue for you to communicate with your providers as well by sending them messages back and forth. And MyChart is ever changing, just like our electronic medical record, just like healthcare. So it's a great area. Right now we're looking at having questionnaires placed right into MyChart, so you're able to gather a lot of that information prior to your visit and have that in your provider's hands prior to ever seeing your doctor.
So if I have access to MyChart, so it's truly my chart.
It is your chart.
And I heard you say communicate to, so can I email or communicate directly to my care team?
You
Yeah,
sure
absolutely, absolutely.
Okay.
So you can send a communication, and likely within 2 business days, you're going to hear a communication back from them.
Okay.
Absolutely.
So is there a charge for that?
Absolutely free.
Oh, okay.
It's free. It's a free service, and we encourage all of the community to really utilize that. It's a great communication tool. Like Katie really alluded to, is being active in your health and being knowledgeable about your health conditions, your lab results, things like that. That's really what we want to see. Individuals who are active in their overall health are going to have an improved health outcome, and so ultimately that is just one of the many ways to be active.
And a lot of patients find it very easy to access your MyChart because there is an app to use on your smartphone.
Absolutely.
So
Okay.
you can just get your smartphone out and access, if you were expecting some lab values, you can just log in on your smartphone and view
Nice.
it just right there at your hand.
Okay, that's great. I know that that kind of access, and as you spoke to, Angie, just to be able to have a more interaction with from the patient to the providers, certainly something has evolved more and more over the years in regards to having more involvement or communication, to patients to be more involved in their own personal health care. They're not just observers.
Right.
Of it. So, and I hear you really speaking to that, so that's great. So like the MyChart is a great tool to be able to do that, as well as Patient Experience Committee to really kind of participate in how care is actually being delivered to a great extent.
Absolutely.
Good. So my last question, so the quality care, the quality in healthcare, where do you see that going in the future? What's going to happen with quality? Do you think it's going to increase, decrease? What's going to happen?
It's always going to increase. I mean, if you think about it, over the years when we started in healthcare, patients would come into the facility and they would maybe be there for 6, 7, 8, 9, 10 days. And really with the improved efficiencies, improving the overall care that's delivered, assuring that we're utilizing evidence-based practices, providers are getting more efficient to providing that care in a timely manner. We're getting outcomes. They're better. Every day we're decreasing our mortality rates, we're improving our infection rates, we're decreasing our complications. So we see that as an ever-changing tool. I can assure you that every year we get new standards and new guidelines in which we need to practice and improve on. So I do anticipate that this will be always ever-changing, and thank goodness for that.
Yeah, and it sounds like, I mean, really for the comfort, benefit of the community, knowing that the standards that we're trying to adhere to or the changes that we're incurring are not just based on what we know in Hibbing, Minnesota.
Right.
This is nationally researched or national data, is that right?
Right. It's reassuring to know that here in Hibbing, Minnesota, you're going to get the same great care if you bring your child in here for sepsis as you would for if you brought him to a larger institution in a metropolitan area. So it's making sure that everybody receives that same quality of care wherever they go.
Excellent. Well, thank you. That's really interesting and comforting to know, I mean, from the standpoint of what great care, but how much is being measured and the quality being looked at and the efforts going into improving patient experience. So that's all great and hopefully benefits the patients and family members that we're serving. Well, thank you. That's our show for today, and thank you for joining us. I want to again thank Heidi Lahti, Angela Olson, Katie Blight, and Stacy Wesley.
Thank you.
Thanks for joining us. It's fun to talk about the quality and patient experience.
David, I would also like to remind our community that October is Breast Cancer Awareness Month, and to please remember to have your annual screening mammogram at the Fairview Range Breast Center, where we have new technology that better detects breast cancer.
All right, excellent. Thanks for mentioning that. I also want to hit again about flu shots. I think
Yes.
you mentioned that, so we want to encourage again our public to be conscious of flu shots and wherever you're receiving care to ask about that. I'm sure we have flu shot clinics as well as others as well. So again, thanks for joining us. Thanks for watching. Watch next month for another program on Fairview Range Focus. Thanks for watching.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.